Assessing brachial artery blood pressure. So for the goal, the patient is measured accurately and the patient is experience a minimal discomfort. So for the equipment, we have the stethoscope, sphygmomanometer, blood pressure cuff, and then pencil or pen, and then alcohol swab, and then also PP if it is indicated. So for the procedure assessment, assess for the brachial pulse or the pulse appropriate for the site being used. And an intravenous or breast or axilla surgery on the side of the body of the patient, and then corresponding to the arm use. So, presence of the cas arteria venis, injured or diseased the limb. If any those conditions are present, do not use a affected arm or monitor the blood pressure of your patient. And then size of the limb, so that the appropriate size blood pressure can be used. The correct cuff should be bladder length, that is 80%, and then the width is at least 40%, and then factors that could affect the blood pressure reading, such as the patient age, exercise, the position, weight, the body fluid balance, and then the medication of your patient. And then after that, note the baseline or the measurement of the previous record of your client. And then for the pain, if the patient is in report pain, give pain medication as ordered before assessing the blood pressure. And if the blood notation concerning to the pain, if the blood pressure is elevated. For the implementation, we have is check the nursing care plan of the for the frequent of the blood pressure. More frequency could be appropriate based on the nursing judgment. And then after that is perform a hand hygiene to remove all the microorganism. And then after that is introduce yourself to your client and verify the client identity. So, hello po ma'am, I'm Arlene Brun. I'm your nurse today from Tarlac State University. May I know your name po?
Lisa Cable.
And then after that is close the curtains, provide the client privacy to avoid any kinds of problem. And then after that is after that is put gloves to proceed to our assessment. So we have here a one pair of non-sterile gloves. And then after that is select the appropriate arm and application of the cuff. And then have the patient assume a comfortable lying or sitting. And then after that is if the measurement is taken is in the supine position. Support the arm with the pillow, and then in sitting position, support the arm yourself or by using the bedside table. And then if the patient sitting, have the patient sit back in the chair so that the chair support is his or her back. In addition, make sure the patient keeps the legs uncrossed. So, check lang po natin, ma'am, kung naka-uncross po yung paa niyo. Dapat din po naka-uncross. Then, after that is expose the brachial artery by removing grommets or move a sleeve if it is not too tight above area where the cuff will be replaced. So, ma'am, i-roll ko lang po itong damit ninyo para po masimulan na po natin yung blood pressure po. And then after that, palpate the location of the brachial artery. Center the bladder of the cuff. And then about midway on the arm so that the lower edge of the cuff is about 2.5 to 1.5 or 5 centimeter rather. And then above inner aspect of the elbow. And then line the artery making the cuff with the patient brachial artery. And then the tubing should extend from the edge of the cuff nearer the patient's elbow. So we have the sphygmomanometer here. And then i-wrap natin tong sphygmomanometer natin dito sa brachial part ng patient natin. Dapat hindi masyadong mahigpit. Dapat normal ay sakto lang yung pagkakarap sa kanya. Medyo mapayat yung patient natin, kaya so yan nakabit na natin siya ng maayos. So, kakapain natin yung pulso dito sa may niya, antecubital. So, dito siya. And then, after that is, check that the needle on the arm gauge with the 0 mark if using a mercury manometer. So, make sure is yung etong ano natin is gauge natin is nasa 0 mercury. And then after that, if using manometer, check to see the manometer is the vertical position and the mercury is within the 0 level with the gauge at eye level. So, nasa 0 siya. And then, after that, estimating the systolic pressure of the patient. So, palpate the pulse at the brachial or radial artery by pressing gently with the fingertips. So, through the use of this finger, ilalagay natin siya dito sa may brachial artery niya. Hanapin natin yung pulso. So, yun, nahanap ko na yung pulso niya. And then, after that, tighten the screw valve on the air pump. And then, inflate the cup while continuing to palpate the artery and note the point of gauge where the pulse disappears. And then, deflate the cuff at 1 minute. And then, after that is obtaining blood pressure measurement. So, assume a position that is no more than 3 feet away from the gauge. And then after that, place the stethoscope earpieces in your ears, direct the earpieces forward into the canal and not against the ear itself. So, I have here my stethoscope. And place dito sa may pulso niya. And then after that is pump the pressure 30 millimeter mercury above the point in which systolic pressure was palpated and estimated. And then open the valve on the manometer and allow air to escape slowly. So, normal naman po yung blood pressure nyo po, ma'am. 120/80. 80. Sakto po siya sa normal blood pressure. Tanggalin na po natin, ma'am. And then after that is note the point on the gauge in which the first faint but clear sounds appear in the in the what do you call this, the systolic. And then after that is do not reflate the cuff once the air being released to recheck the systolic pressure reading. And then after that is note the point at which the sounds completely disappear. So, and then after that, allow remaining air to escape quickly, and then repeat any suspicious reading, but wait at least 1 minute, and then deflate the suspicious reading, but wait for 1 minute rather. And then after that is when measurement is completed, remove the cuff, and natanggal na natin yung nakalagay dito sa brachial artery ng patient natin. And then remove the gloves na sinusuot natin, and then perform a hand hygiene. And then after that is alcohol to remove all the microorganism. And then after that, help the patient in the appropriate or in a comfortable position. So ayos po tayo, ma'am. And then after that is clean the diaphragm of the stethoscope with the alcohol wipe. So I have here a towel. Let's assume that this is a paper towel or tissue. And then after that is for the evaluation, so bago pa lang lahat is ililinisan din natin yung sphygmomanometer natin para matanggal yung mga microorganism na kumapit dito. Dahan-dahan lang tayo. And then after that, for the evaluation, the blood pressure is measured accurately and without any injury of the client. And then for the documents, record the findings on the paper or a computerized record. So, ma'am, yung blood pressure nyo po is normal lang po siya, ma'am. So, 120 over 80 po siya. And then after that is report abnormal findings to the appropriate person, and then identify the arm and site of the assessment if other than the brachial. So this is the end of the assessing of brachial blood pressure rather. Thank you po, ma'am.